Dr. Gulani, it's just so good to be with you here today. And I have some questions for you. And you know I'm your patient, and you've really helped me tremendously. I had RK surgery, had all the cuts and so forth back about 20 some years ago. Woke up some mornings and now my vision's going away. What do I do with this? I have been to different doctors, doctors that supposedly knew what they were doing. And basically they just told me there's nothing we can do. I have to live with it. So, and being an RK survivor, that's what I call myself, I have done quite a bit of research, layman research on it, and found out that there's not very many people that give much hope. And so I found you, and as over 10 years ago. And so I'm glad I did. And right now you have done surgery on my eyes, replaced my lens and so forth, and it's going good. I have good vision. So here's my question to you, and we'll get right to the point. Okay, so
that was your radio show, right?
I had a radio show that was called Right to the Point, so people didn't go blah 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 blah. They got right to the point. So here's my point: how do you do your work when there are so many people, doctors and stuff, that are out there that say, "Hey, we can't help"? What are your techniques that you use to give people like me, especially, hope? That's got the weird eyes.
First of all, it's now 2 years since I did your surgery.
2 years.
Right? So again, like all my patients here, it's an honor. You traveled back from Idaho today for your follow-up, and always my pleasure to see you guys. Like
Thank
you
you.
said, you researched, you stalked me for 10 years.
I did. I did.
Like all my patients, I'm
Yeah.
used to it. But no, this is very important, Tim. As you know, I've been teaching my concepts for nearly 3 decades now, all over the world. Surgeons come here, we let them watch. My staff, my team puts out videos nearly every day on LinkedIn, Instagram, YouTube, Facebook, name it, because we're transparently showing how I'm doing my surgeries. And we're doing something even more important. I'm showing all my patients, all of you, remember even during your surgery, impromptu on video immediately, before, during, after surgery. And then when you'll come back years later. And there cannot be a higher proof or higher accountability than that. And because none of you are predictable people, it's not a simple LASIK, I know how you'll see, so I put you on camera.
Right.
You're all unpredictable, difficult, plus very intelligent, skeptical patients when you come here. So your 10 years of research, and you came here 2 years ago and we did your surgery today, you're seeing great distance and near without glasses. And if you see, I discussed with you my plan, I still also do the moist therapy on top, because you have a lot of dryness going on. That will also decrease the fluctuation, increase your vision quality. And there is even more I can do. Not needed in many cases, but if your scars are further worse on the cornea, I can even do laser plastic on that. Then I really have reversed your history of RK all the way back. Even though your RK cuts are still there, because they were 95% deep.
Right.
So there's a lot that can be done. But the approach to RK eyes should be holistic. You have to be an expert in the ocular tear film, dry eyes, before which I do the moist therapy. You have to be an expert on the cornea, because that's where your main problem is. Your windshield is broken, right? Like in your case, even though you don't have 30 cuts, it's less than that. You have RK cuts with the step ladder cut called the Ruiz astigmatic cut, which caused so much astigmatism in you.
Yes.
But there are over 34 lens implant choices that I use in these cases. So, like you rightly said, how do I do it? I mean, it's very gratifying to see all of you, and you'll have seen without glasses that too. And remember, none of that is something that is guaranteed to you when you'll come here. But my desire is, yes, I want that for y'all. So the fight is intense. How many times I measure y'all, re-measure y'all before surgery. In surgery, then again I call you, I make you travel back for your second eye. All those things.
Right.
So I believe every doctor can do this, but you do have to have holistic skills, right from tear film to cornea to lens-based cataract techniques, all kinds of cataract techniques, all kinds of lens implants, and then how to combine the lens-based surgery with the corneal surgery, because that's needed in some RK cases.
Right.
So first you have to be an expert in all these. You have to also have the experience to diagnose the problem. What is causing the vision issue? Like in your case, if you have over 8 diopters of irregular astigmatism, can we still fix it through the lens because of age? Since your lens was already cloudy, we did a surgery, not cataract surgery to the next level of artistry. I call it lensoplastique. That's how we pioneered and patented it. Because that allows me to fix not only the cataract, but cancel the impact of the broken cornea without touching the cornea. That's what you're looking through.
Well, I just want to say something here, because we're going to get right to the point. My point is, in researching you for 10 years, what I really appreciate about you is your confidence, and your ability to articulate exactly what the issues are. Because a lot of doctors aren't willing to do that, probably because they can't. And not because they won't, but maybe because they can't. And so I just appreciate you so very much with your confidence in what you've done. I'm happy with what I have received from you, and just look forward to having great eyesight into my 100s and 120s.
I'll keep seeing you back from Idaho.
Yeah, there you go. All right.
So please, RK patients, it's an honor. This is the middle of a busy day. Every time at our institute, patients from all over the world here, nobody waits. It's our pride that everything's on time. But when my patients come here and they want to discuss something for the benefit of patients like them in faraway lands, in your case, Idaho, but you saw today people here from Sweden, Minnesota, Toronto, all over. RK people we did yesterday, we're seeing them post-op today. I don't want any RK radial keratotomy patient to feel that nothing can be done. There is no such thing. You can be helped. And no, you don't need surgeries that are drastic, like corneal transplant or something, or cataract surgeries that are ordinary. It has to be planned. Every surgery on you now, after your RK but done 30, 40 years ago, has to be intelligently planned, has to be properly discussed. All the visual problems have to be outlined and, like you said, articulated to the patient. You have a dry eye, your cornea is irregular, there's a scar, there are 20 or 30 cuts in the cornea, fluctuations. You also could have Fuchs dystrophy, like I did another guy from DC yesterday, Fuchs with the RK. So that can also cause corneal decompensation. Your cataract, is it a polar cataract? Is it a nuclear cataract? Is it a cortical or a dense white cataract? Then what lens implant? Because remember, RK not only cannot be not measured accurately, on top of that it moves, fluctuates.
Right.
So you have to have the skills and experience. It takes me hours to plan what to do. Then in majority of the cases, I use lenses that have a toric aspect or astigmatism aspect to it, because I believe that is the most important optical principle with which to cancel the optical abnormalities of the broken RK cornea. So that's very important. But now those are the most difficult lenses to do. That's why maybe many doctors don't suggest that, because not only have you got to be accurate in the power, which in RK is difficult, but you also have to be correct on the axis of where you align the lens. If you make one mistake, you'll have double, triple vision.
And I believe that's what you used in me.
Absolutely, because of your extreme stigmatism and irregularity from the Ruiz cut over your RK cut. So very important that there are technologies out there, but you cannot be given an option of just use the platinum, gold, or garbage option 3.
Right.
Wrong. You cannot get a menu card. There are options as a master chef, I say. The lens implant is just an ingredient. Important ingredient, but just an ingredient. The vision recipe and the ability to put it together with the holistic ability and skills in all your RK unique eyes, what's important? Because we're seeing an explosion, Tim, since I did your surgery, since a year now, of doctors advertising new lens technologies and stuff, and patients falling for them, and then they're coming here in droves, disgusted, angry, disappointed, depressed.
Such as the LAL surgery, that the lens that now is kind of being promoted for RK people even. Yeah.
Again, the lens and the technology is not wrong, but the application is not in the right direction. You can't just put in a lens and then say, I'll take 3 opportunities to get this right. You're not addressing the issue here. First, you got to be accurate in the surgery. You don't need 3 adjustments.
Right.
Second, you got to fix the cornea, if at all, to make the eye see perfect. Now, if you go on correcting, like you saw many patients even here today, they come in angry because they've fallen for these advertising. Now they have that lens in the eye, and doctor has done whatever they could, and now they're saying live with it. Patient feels trapped. They have to be helped.
Right.
So it's becoming an explosion. I've been calling it an epidemic as I spoke at the national meeting last month. You got to get educated as RK patients. Right. You know, you've been through a surgery before, RK. I don't believe any of the surgeons who did your surgery did it for any wrong reason. They did try to help you. They tried to help you. I never did an RK because I never agreed with the anatomical cutting vertically on a horizontal tissue, cornea. I had admiration for all these doctors. They all tried to help you, nothing wrong. But now, you got to do an intelligent surgery to reverse it, and long term. Most of you at this age have an early cataract going on. So you don't have to wait till the cataracts mature. Fix it. Make sure the doctor understands all the lens technologies, what goes in. Make sure they can understand the cornea, the tear film, only holistically if it's understood,
right,
articulated,
right,
performed, and followed up.
Right.
we
And
see success.
I just want to say something here too. See, and if anybody watches this, this is what Dr. Gulani explains to you as a patient when you go into his room. I've never had a doctor ever do that, to give an explanation and actually become a dictionary and clarify these issues, which is so very, very important. That's what gives you confidence when someone can articulate exactly what, even if you don't understand it. Like half the stuff that you said there, I didn't understand,
Have to
but
understand.
but I can appreciate it because I know you know what you're doing, you know, and I'm proving that. And I'm very happy. I ride my motorcycle. I'm active. I never stop. So I appreciate what you've done so very, very much for me, and looking forward to, you know, having other stuff done where I just dialed in. So appreciate it very, very much.
Safe travels back to Idaho,
All right,
Tim.
all
Pleasure
right.
seeing you. That's
Okay.
an honor.